I'll list some of the medical conditions that can actually cause the depression, in which case it can't really be called major depression. Stroke, very common for stroke victims to have a change in mood or personality. I remember one in particular. I was an internal medicine intern, and I admitted this lady who had a stroke. She was in her 60s, and she was really a delightful person. In spite of the stroke, she was optimistic. She had a sunny personality. She had a good sense of humor. She tried to make me feel better as an intern, a very overworked intern. And she was just nice to be around. And her husband took me aside and said, you know, I'm really glad she had this stroke. Which took me aback. I said, well, why? What are you in what way? How does that make you happy? He said, first of all, she's not disabled by it, and she's going to recover. But more importantly, before she had the stroke, she was an abrasive, flaming bitch. That is his words. She was impossible to get along with. She was pessimistic. She got rid of a lot of her friends. Couldn't stand her after a while, and the stroke just changed her personality and mood. She had an ongoing dysthymic disorder that was just no longer there. Multiple sclerosis is notorious for causing manic episodes, or mixed episodes, which I'll define later. But it's more common for it to cause depression. And as a doc, you can look for MS and some of these other things. Thyroid problems. I remember one, Peter Van Auken saw this young woman who was a little bit hypomanic, but not impaired. She was energized, talking kind of fast, cleaning her house a lot, but not really impaired. But then, while she was driving with her two small kids in the car, she didn't really have a hallucination, but she got the feeling that God was talking to her and directed her to drive her car at rather high speed into a stop sign as a kind of test, which she did do. She felt like she had to listen to this feeling. And, she was hospitalized, first in the hospital, then psychiatrically. Her kids were taken away from her by Child Protective Services, and she was absolutely distraught. She had no history of any psychiatric disorder, but she was kind of young. She was around early 30s. And this just, it didn't hang together for either Peter or me. So I inherited her as an outpatient after she came out of the hospital, and I ran a thyroid test, and she was hypothyroid, which is very, very common in young women. And I gave her some thyroid medicine, and her hypomania went away, and she was normal. I mean, I followed her for a year, every month, because I wanted to see really if she was, bipolar with the thyroid condition. But the answer is no, she wasn't. And after a year, I just said, well, I keep taking the thyroid medicine for life. Okay. So I think that anyone with any kind of mood disorder deserves an evaluation by a physician. Okay? I was in MFCC, I respect them, but they don't know about these medical conditions. They simply don't know. They were told about it once in their training. That's very different training than what a doctor gets. Now, another important differential diagnosis is somebody comes in with a major depressive disorder that I described, major depressive episode, they're kind of young, in their 20s, early 30s. what is the chance that they're really bipolar but haven't had a manic episode yet, or a hypomanic episode? By definition, bipolar type 2, for example, means you've had at least one hypomanic episode and at least one major depressive episode. Okay? And so, suppose a young person has the major depressive episode first and hasn't had the manic episode yet, but they're really bipolar, and that's going to unfold. Well, the answer is you can't really treat them for bipolar, or you really shouldn't until you've seen clear evidence of hypomania or mania. And you have to get a careful history for that and talk to family members for that, and other people know them, their doc, and so on. I look very carefully at family history. Bipolar tends to run in families, and if any first-degree relative of theirs has had a bipolar diagnosis, I'm really on the lookout for this person being bipolar too. Similarly, if the depressive episode has psychotic features, by that I mean hallucinations or delusions, then there's a reasonable chance this person is going to, already is bipolar, but just hasn't had the manic episode yet. So I've talked about bipolar. I'll get to it, I'll define it a little better in a minute. Another common cause of depressive symptoms is from substances. And those substances can be illegal drugs, or they can be prescribed drugs, or they can be herbs, or supplements, or stuff you get from China that you don't know what the hell is in it. I worked up at the Sierra Family Clinic being a consultant up there on the bridge for a while, and it was very common for people to be referred to me depressed. And they were on a whole bunch of opioid medications like Vicodin, OxyContin, etc. Those things are central nervous system depressants. And perhaps they would be depressed without them, maybe. But it's just as likely that their depression is caused by these prescriptions. And I would tell Peter Van Houten, you know, I can't diagnose major depression when somebody's on all this stuff. Cut it down or stop it for a while and we'll see, which presents problems. They're addicting. You try to stop it, people don't like it. They get withdrawals. Similarly, alcohol is a central nervous system depressant, and chronic alcohol abuse or use can lead to depression, secondary to alcohol mostly. Coming off methamphetamine, I see this a lot. People go on methamphetamine binges for a long time. When they're done, their neurotransmitters are almost completely depleted, and they get a nasty depression. But it's not really a major depressive episode. It's because they use the methamphetamines and are now withdrawing from them. Okay? There are medications that can cause depressive symptoms, like beta blockers. Not uncommonly, I get elderly people, mostly women, who use eye drops for glaucoma that contain timolol or another beta blocker. And a little questioning tells me that their depression started after they started using that stuff. The beta blockers cause them to be depressed. Not uncommon at all.